Hi, in this class of pathology, we'll be talking about homeostasis and hemodynamics. Okay, so as a clinical nutritionist, and when we go for rounds in wards and when we see inpatients, we come across so many terms, so many clinical terms like edema, ascites, and dropsy or anasarca, and what else? Congestion, then thrombosis, embolism, thromboembolism, and tumor embolism, hemorrhage, dehydration, hypovolemia, shock, failure. All of them, they are related to the homeostasis and hemodynamics. That means the fluid mechanics in our body. So there are basically four important topics in pathology, right? When we talk about pathology, if you can master these two areas in pathology, say for example cell injury, right, and second one is this one, homeostasis and hemodynamics, third one is inflammation, and finally immunopathology. If we spend considerable time in learning these four basic pathologies or pathology principles of pathology, we mastered the clinical nutrition completely. So in this, homeostasis and hemodynamics is one of the most important topics. So when it comes to homeostasis, what does it mean? So let's take a small tissue. Okay, this is our small capillary, right, and this is like, so this is a venous end of the capillary, and yeah, and this is the arterial end of the capillary. So this is in red, and this will be venous end, will be in venous end, and it's in venule, a small venule. Now we have our cells here. Okay, these are all cells that are supplied by these capillaries. So we have nuclei inside, and again we have cells over here with nuclei. Okay, now this capillary wall is lined by a specialized cells in our body called what? Endothelial cells. Okay, these are lined by endothelial cells. Okay, now blood is entering in this direction, supplying the tissues and the cells in the tissue. Okay, and here the fluid exchange and nutrient exchange takes place and is collected by a venule and is moving away from venule, again to be going into the right atrium. Now, what is homeostasis? How do you define homeostasis? Okay, so this is called internal environment. So the fluid is coming, perfusing a tissue and going out, and in the meantime the fluid and nutrient exchange is taking place. So what are the players here? The players here are cells in a tissue. Okay, now these are cells in a tissue. It can be any tissue. It can be liver tissue or kidney tissue or muscle tissue, skin tissue. These are cells in a tissue. Now this is a capillary. So this is a capillary. This is venous end, This is arterial end. And what else is there? This, what we see here, this we have space. This space is called what? Interstitium. Okay, this is interstitial space. Interstitial space is filled with connective tissue. Okay, made up of proteoglycans and all this stuff. So they provide the cushion. This is where the nutrient exchange takes place. Now, the normal function and physiology or morphology of the cells is to be maintained. Okay, so the artery is bringing in different kinds of nutrients, different kinds of fluids. So imagine a person here is an individual, right? So he is taking in food, incoming. So food and fluids are coming in. They are digested and entering into the internal environment. They are absorbed from the gut into the circulatory system, right? So this is entering into the internal environment. If there are subtle changes, in the fluid, whether it is in the interstitial space inside the cell or in the vascular compartment, all of them, they strive to maintain normal morphology and function of the internal environment or the cells in a tissue. This is called homeostasis. How do you define it? The mechanism by which the internal environment of a tissue is maintained is called homeostasis, right? So homeostasis is imbalance. Homeostasis is when an organism and its tissues are in balance. They are maintaining normal morphology. So now, what are the parts of this homeostasis? What are the different kinds of situations we can come across? Say for example, if you look at the components or the players in this internal environment, what are the main things? There is predominantly water and electrolytes. Okay, so there can be imbalances in water or there can be imbalances in electrolytes. Right? Say for example, water imbalance may lead to edema. We all know that edema is a swelling, right? This can happen in different areas. It can happen in like cardiac edema or renal edema, which we see in cases of chronic renal failure, nephrotic syndrome and all those conditions. So different kinds of edema are present. If we understand that it is imbalance in water that is leading to edema in a particular organ, our problem is solved. The concept is very simple. In the similar way, there can be disturbance in electrolytes that are moving in the internal environment. So we have different kinds of electrolytes, both cations that are positively charged and anions that are negatively charged. There can be imbalance in these electrolytes. Say for example, hyponatremia, lack of sodium. Hypernatremia is more sodium. Increase in pH levels of a particular fluid in the system. So this leads to, it can be like acidosis or alkalosis. Right? This is like another set of conditions. So the disturbance in water or the disturbance in electrolytes is one. So this is coming to the components that are involved. The components that are involved. Why edema occurs? What factors maintain the water level in a particular tissue or an organ? We all know that there is something known as crystalloid osmotic pressure, colloid osmotic pressure and all this stuff, hydrostatic pressure. What are the causes that are leading to a derangement in this thing and how it is leading to edema? That we'll see. So first we list out what comes under homeostasis and hemodynamic derangements. derangements in hemodynamics. So next comes hemodynamic circulatory system obstruction, obstructive type, right? So the blood is supposed to move in vascular compartment, is it not? The blood is supposed to move in a vascular compartment. Say for example, if there is a block, this particular area is not being perfused. This particular area is not being perfused, meaning what? There is no oxygen and there is no food, that is nutrients, right? So this is hemodynamic derangement of obstructive nature. So what comes under this? Say for example, thrombosis, right? We all heard of thrombosis. So thrombosis of coronary arteries leads to what? Ischemic heart disease, leads to heart attack. We call this as ischemic heart disease. One example is ischemic heart disease, or in common terms heart attack. So it is a hemodynamic derangement of obstructive nature. And you have another component called embolism. So what is embolism? Embolism is a particular thrombus. It can be anything, a thrombus or any particular material that is obstructing. So here thrombus is formed here, something comes and blocks, obstructs this area. This is called embolism. So apart from embolism and thrombosis, we have different other kinds of embolisms. I mean, in embolism there are different kinds, like it can be pulmonary embolism, tumor embolism, fat embolism, amniotic embolism. We go through all of them step by step manner. What happens if there is, obstruction? There is no fluid that is going in, and the cells, they enter, the tissues, they enter into a stage called shock, right? They enter into a stage called shock, and this leads in necrosis or degeneration of this tissue, leading to an infarct. Okay, and the fourth mechanism by which the hemodynamics are deranged is lack of enough fluid. So fluid imbalance. So the circulatory, this is obstructive, this is loss of fluid. So loss or disturbances in fluid volume. Let's say fluid volume. Okay. So say for example, there is something known as hemorrhage, right? There is a traumatic injury and there is severe loss of blood from a person's body, and the derangement that occurred in that particular individual is hemorrhage. What kind of changes that will happen in this particular individual? That's what we are going to study. Second one, what if there is increased circulation to a particular organ? So that is known as hyperemia. So in this hyperemia, again there are two types. Okay, there are like active hyperemia and passive hyperemia. This passive hyperemia is also called congestion. Okay, so this particular topic, homeostasis and hemodynamic derangements, is one of the very important chapters. Once you master all the concepts that are involved, so how the body balances the water. Where is water contained? Water contained in both extracellular compartment and intracellular compartment. What is extracellular and what is intracellular? That we need to know. What is maintaining water in the intracellular compartment, and what kinds of things are maintaining water in the intracellular compartment, and what disturbs them so that water is coming out or is deranged, leading to an edema. Like that, if we study electrolytes, acid-base imbalance, acidosis and alkalosis, metabolic and respiratory, both of them, and we study both obstructive circulatory derangements and loss of circulatory volume in the body. Once we study this, we apply the same things to the physiology we already know, right? Say for example, in the class of cardiac issues, we discussed congestive heart failure. So, if we know the concept of congestion, what exactly is congestion? It is a form of passive hyperemia, right? So, why there is congestion? What are the factors that are leading to congestion? It could be because of ischemic heart disease. The heart is not able to function. That leads to congestion of lungs, and it has got set of clinical features. Okay, so being a dietitian, do we need to know all of them? Yes, we do need to know at least the definitions or the basic understanding of the pathology involved behind. Say for example, in certain conditions, in certain hyperemias, okay, say for example, you take Cushing Syndrome or chronic renal failure, what happens is like blood is perfused and there is retention of water and sodium in the body. Okay, so we have to be very watchful when it comes to fluid balance. You might have seen in your renal nutrition practice that the fluid that is entering and the fluid that is going out is measured very carefully, because we don't want to disturb the existing pathology. So if doctor asks what is the input and what is the output, we should be in a position to know. And before that, we should not be looking at the patient. The moment you understand that this particular condition means this, you go into this level. Okay, his kidney is having a pathology. Healthy kidney should look like this, and in unhealthy condition, this is where the imbalance happened. Once we understand this, it is very easy for us to master the concept and give advice to our clients. Now, coming back to the implication of medical nutrition therapy in any kind of clinical condition is what? See, if there is a cause leading to a particular pathology, maybe it could be lifestyle or eating habits, certain kinds of irritants or like eating foods that are aggravating these conditions in a person's lifestyle or in diet. So we need to look for that. Say for example, a person is having diabetes for so long, and we discussed already in early complications and late complications of pathology of diabetes that how the pathology occurs inside a person's body over a period of time if uncontrolled. So that is because the person is taking food that is not balanced and that is not helping in healing or regeneration of the tissues. Okay, if we can identify certain foods that are harming or aggravating the health condition, so our aim as a nutrition therapist, our aim is to eliminate this cause. Okay, and second one is we need to identify foods that have therapeutic value. Okay, therapeutic diets. This is where most of us are stuck. We say like, okay, hypertension, low salt diet. That's it. We don't see what is exactly happening inside the patient's body, for how long he is taking, or any kind of foods are activating the system. So we are stuck at like therapeutic diets. A dietitian's role in management of hypertension is stuck with only low sodium. But if we understand hemodynamics, right, this hypertension is acting on liver like this, is acting on brain like this, and is acting on kidney like this. This is what it is, the damage that is happening. So if you know all the levels of damage that is happening, then you can plan your therapeutic diets very well. Okay, this particular food will help in the regeneration of the damage caused by the hypertension in liver or in kidney or in brain. So this is how we should be planning. And the third most important thing when it comes to medical nutrition therapy is that you look at the medication. So the medication, we need to identify the synergy. So certain drugs, they work well. Say for example, somebody who is having a chronic lifestyle disease, most of the doctors, they simply write vitamin E, right? What do they mean? Why are they giving me vitamin E? It is simply because it is an antioxidant. It does have antioxidant property. That is one of the main reasons. Of course, there are other reasons why they prescribe vitamin E, and they prescribe multivitamins. If somebody on antibiotic, they'll give anyway multivitamins. And if people are on more drugs, more than 3 or 4 drugs, automatically they'll give an antacid, preferably a pantoprazole, that is proton pump inhibitor. So, can we do something to prevent the complications of taking this medication? Right? So, every drug needs to be detoxified by the liver. Right? Liver plays an important role. So, the drugs that are taking are becoming toxic in the first level to the liver, and in the second level, once it is hydrolyzed and it is sent to kidney, from there it is eliminated. So for body, that means for both the liver and kidney, all the drugs are becoming toxic. Okay, imagine that, imagine a patient taking 10 to 15 drugs, lying in an ICU or in a ward, or somebody who is taking BP and sugar and arthritis medication on a regular basis. What is happening to their liver? Can we do something with our diet planning to detoxify the liver, to give enough nutrients? Say for example, cytochrome P450. This enzyme system, if it is functioning well, it can effectively detoxify the liver. So how do we boost up the cytochrome P50? We all know that curcumin, right? Curcumin helps in improving the functionality of cytochrome P450 enzyme system that is there in the liver. So that we'll see in our biochemistry class, where we discuss liver and its detoxification mechanisms. And the synergy, how will you achieve this synergy? Say, if somebody is giving metformin or some kind of anti-glycemic or hypoglycemic drug, as a dietitian, what is our job? So this drug is able to achieve, or this much dosage of insulin is able to handle the sugar level like this. What if we plan a diet that will work with the drug so that the effectiveness of the drug will go up? So for all these purposes, the medical nutrition therapy, when you are planning, especially clinical diets, you want to achieve, we all want to make a difference in our client's life or our patient's life. Okay. Only thing is, like, we need to spend, I told you already that there are 4 important subjects in pathology. If you can master them, right, everything will be easy. Anatomy, physiology, even if you learn basics. So muscle, you need to learn about the physiology, that contraction and relaxation, it requires calcium and magnesium. Okay, relaxation ke liye magnesium, calcium is contraction. That physiology is fine. And when it comes to pathology of the muscle, or for example, if you know the function of the brain is control and coordination, it sends out signals, and there is, basic fundamental pathology. Parietal area is taking care of this particular function, occipital area is taking care of visual function. You know clearly that with these 4 areas, what are they? One is cell injury, what happens when there is a cell injury, and second one is like inflammation, third one is hemodynamic changes, and fourth one is immunopathology. If you learn about these 4 things, it will take some time. I request you all to go through this video again and again. We'll be discussing all of them at length. This forms the basis of our pathology series. So I want you to spend enough time, go through this video time and again, so that you will understand the concept. I try to keep it as simple as possible. So we'll start with water and its imbalance in our next class. Thank you.